What you're seeing on the screen right now is not just yellow staining on teeth. This is hardened tartar, a buildup of bacteria that has been sitting on these teeth for months, sometimes even years. And the scary part? Most people don't even realize it's slowly damaging their gums until it's too late. In today's video, you'll watch a real-time professional dental cleaning where heavy tartar buildup is being removed using specialized dental tools. We'll also break down what tartar actually is, why it forms, the risks it carries, and why regular cleaning is not just cosmetic, it's essential for your health. Tartar, also known as calculus, starts as a soft, sticky film called plaque. Plaque forms when bacteria mix with food particles and saliva in your mouth. If this plaque isn't removed through proper brushing and flossing, it begins to harden within 24 to 72 hours. Once it hardens, it turns into tartar, and at that point, it can no longer be removed with a toothbrush. It bonds tightly to the teeth, especially around the gum line, creating the perfect environment for bacteria to grow. So what causes tartar buildup? Poor oral hygiene is the #1 reason. Irregular brushing, skipping flossing, or not cleaning properly along the gum line. Frequent consumption of sugary foods and drinks also feeds the bacteria that create plaque. Smoking or tobacco use significantly increases tartar formation and staining. Even dehydration can play a role because less saliva means less natural cleansing in your mouth. Over time, all of these factors combine, leading to thick, visible tartar deposits like the ones you see here. Now, watch closely as the dentist begins the cleaning process. The tool being used here is called an ultrasonic scaler. It uses high-frequency vibrations combined with a gentle stream of water to break apart the hardened tartar from the surface of the teeth. As the tip moves along the tooth, you can see chunks of tartar lifting and separating. This is something that cannot be achieved with regular brushing at home. The water spray also helps wash away debris and keeps the area cool during the procedure. Notice how the dentist carefully works around the gum line. This is where tartar tends to build up the most and where it causes the most damage. In some areas, manual tools may also be used to remove stubborn deposits that the machine can't fully break down. Slowly, layer by layer, the natural tooth surface begins to reappear. What was once covered in thick yellow buildup is now becoming clean and smooth again. But why is tartar so dangerous? Tartar is not just a cosmetic issue, it directly affects your gum health. It irritates the gums, leading to inflammation, redness, and bleeding, a condition known as gingivitis. If left untreated, it can progress into periodontitis, a serious gum disease that can cause bone loss and even tooth loss. Bad breath is another common result, caused by bacteria trapped in tartar. In severe cases, infections can spread deeper into the gums, affecting overall oral health. As the cleaning continues, you can clearly see the transformation. The teeth look brighter, smoother, and healthier. The gums also begin to return to a more natural state, no longer irritated by the hardened buildup. This is the result of a proper professional dental cleaning, something that should be done regularly to maintain oral health. So how can you prevent tartar from building up? Brush your teeth at least twice a day using proper technique. Floss daily to remove plaque between teeth where brushes can't reach. Stay hydrated and limit sugary foods and drinks. And most importantly, visit your dentist regularly for professional cleanings. Because when it comes to tartar, what you don't see can hurt you the most.